SLA Kit is Sinus Lateral Approach Kit since 2008. The LS reamer can be used when it is required to care for the artery bleeding septum existence on the drilling path, or to make a lateral hole in the overlapped region of inferior cortical wall and cancellous bone layer. Open the flap. Sometimes you can do only small incision for window opening. Drilling should be performed with a firm grip and vertical force on a handpiece to get a good stability. When using 21 handpiece, maximum speed is 2000 rpm. During drilling, LS reamer makes thin bone layer. Even if reamer touches sinus membrane, it is safe. Furthermore, because of thin bone layer, reamer doesn't touch the sinus membrane directly. This layer makes safer. Number 1 Sinus Elevator. First, detach membrane on the mesial and distal sides using number 1 elevator. Number 2 elevator. Use the L-shaped side for detaching the lower part of the lateral wall. Using the opposite side of the elevator, contaway to elevate the entire sinus floor. Number 3 elevator. Specially designed to safely enter deeper into the interior part of the membrane. Further elevate rest of the membrane to prepare for bone graft. Add bone graft materials. We recommend covering the site with the absorbable membrane.